Okay.
15 minutes left. 20. All right, guys. Today we're going to talk about proper emergency response techniques. What would you guys consider an emergency? Like, if you, yeah, a broken leg, yeah.
Heart attack.
Heart attack, definitely. Anybody else? Stroke.
Like a stab.
A major wound, stab, severe bleeding. Would you guys consider a burn as emergency? Could be, maybe.
Severe.
Like, what are some type of burns? Like,
3rd degree.
third degree? What?
Eighth
First
grade,
degree.
you're on.
So like a 3rd degree, does anybody know what a 3rd degree is classified as? It's like where it's the burn is so bad that it like bone shows and muscle shows, tendon. A 1st degree is like just a slightly red skin, irritated, pain sensation. Let's see. What should be the first thing you do if you're in an emergency situation? Now, you're not the victim, but you come on an emergency situation.
Call 911.
Call 911. That. And does anyone know another step you should take whenever you, yes?
Check the scene.
Check the scene. Great. Wow. Yes. Check the scene. You also want to get consent if you're talking to a conscious victim. Like, you want to make sure that it's okay for you to work on that. In this video, we're going to go over a few things. This video gets silly at some points. But the information in it is pretty important and could really help you if you get in a situation where emergency calls for action. In this section, we're going to be talking about a conscious choking victim.
Are you okay? Are you okay?
Really? Yeah.
Is it bright? The brightness on YouTube.
Man, I really appreciate the students.
You can turn the lights on the,
Yeah, that's
Ladybug.
one big with glare, it's gonna leave.
yeah, all right. We can see it.
Are you okay? Are you okay? Call 911.
All right, so in that first scene, I know it's really hard to see, but what was anything that you guys noticed about that, if you could see it at all? Yes, in the back.
The guy that had his hands over his neck.
Yes, the hands across your neck like this is the international symbol for your choking, or universal, international. But anything else? Like, what about the person that was responding to the emergency? They
Told somebody to call 911.
They did tell someone to call 911. A scene you did not see in that was they didn't ask for consent before they went to conduct CPR. That's one of the first things you need to do. You ask the victim if they're okay, and then ask for consent. Can I help you? Can I provide life-saving support for you?
Although this is not a human body, it's what's right? So a person's choking, conscious person. 5 back blows. 5 abdominal thrusts. 1, 2, 3, 4, 5.
Good form.
Then you go back to back blows. 5 of those. 1, 2, 3, 4, 5. Continue that process over and over. For again, until emergency responses come or the choking person stops choking.
All right. Probably couldn't hear that, but from the actions you saw, what was the sequence?
5 back blows and then 5 abdominal.
5 abdominal thrusts. Do you stop after you do the first 5 and the next 5? Keep going. When would you stop? When would you stop giving the 5 back blows and 5 abdominal throws?
They go unconscious.
If they do go unconscious, yes, and then we're into another emergency response. Yes, sir.
If they're no longer choking.
If they're no longer choking, exactly. And also if EMS arrives. If they arrive, let them take care of it. They're professionals. Your job is done. You've done as much as you could. Burn victim. This red light is the stove, and this victim, for some reason, has put their hand on top of the stove and has proceeded to burn their palm. You can see they're in agony. I'm sure they would be.
It looks like you.
Twin brother.
Make sure the water's on cold. Burn area. Clear the water for 5 minutes.
All right. So you saw there that that man had stuck his palm down on the burner and had a bad burn on his hand. The first step he said was to what in that situation? Yes, kind of. Remove your hand. But it could be worse. It could. What if it's not a stove? What if you're in a situation where there's an open fire and a person's stuck in a car? It's not going to be as easy as moving your hand. It's going to be you have to help that person out, or you're going to have to get yourself out of that situation. And the next step on here, it says cool the burn for 5 minutes or until the pain is relieved. So 5 minutes is, kind of standard for at least a first degree burn. But for a second degree burn, you want to third's tough, but second, you want to make sure the pain is somewhat relieved. Now we'll go to step 3.
We're in attendance. Sterile calls for this purpose. Alright, you want to wrap the affected area after you cool for 5 minutes. And sterile calls, loosely. Don't pack it too tight. Area's tender.
Let's just try to keep a serious attitude about some of this. I know a lot of the content's a little silly, but a lot of information in this is very serious and could really be helpful at some point. He did say that the prop used now was toilet paper, but what was it representing in that situation?
Sterile.
Sterile gauze, the big key, sterile gauze, or just sterile dressing in general. And do you want to wrap that tightly around the wound, or do you want to keep it loose, right? Because it'll hurt them. You don't want to cause more pain than they're already in.
Once you wrap the affected areas, call 911. Or the person is very flammable. I will call 911. Yes, 911. I'm a burn.
So again, make sure you call 911 no matter what. If it's a first degree, I can understand maybe you can take the person to the hospital. Second and third, it can get severe and probably cause infection. Get the ambulance there as soon as possible, especially in a car accident where if there's open flames or any situation where there's an open flame. Make sure that you call 911.
Once you've done all these steps, care for the victim and make sure they don't go through shock. Shock can be if they're cold, if they're lightheaded, or they can pass out. So provide them with a blanket and support. Wait till emergency services arrives.
All right, again, shock. Does anyone know what shock is? Any clue or any symptoms of shock? Okay, so shock could be like you said, you feel lightheaded, you feel like you're gonna pass out, you start feeling cold, you're not yourself exactly. But for the person that's there helping the victim, it's a major key to stay after. And even though the EMS has arrived, or even though you've taken care of the burn properly, that you stay there and stay with the victim to make sure that they can sit and get through the situation they're in. Wrap a blanket around them, just provide support, either moral support or you might have to provide physical support at some point. Maybe help them get to a certain location. I'm going to forewarn everybody, there's no body used, there's not an actual person using this. Again, it's a body pillow representing a person, so don't be thrown off so much about that. Alright, you probably couldn't hear the video there. Whenever you're first attending a victim that appears to either be unconscious or in a serious incident or accident, you want to check the scene for safety, just like Andy said earlier. So, what does that mean to check the scene for safety? What are some things you want to check for whenever you're doing that? Yes, Kyle. Open fires, yes, just like the video said. Anything else?
Maybe like pieces of glass.
Pieces of glass, yeah. If you're in a car accident, there'd be definitely glass, metal, there'd be a lot of things around. Anything else?
Falling rocks.
Falling rocks? Very good.
Bad guys.
Bad guys, that's a good one. A lot of people don't think about bad guys. Somebody with a gun or somebody trying to hurt somebody. I mean, maybe that victim was attacked, and that's what you want to watch out for. What was the last thing, I don't know if you could hear it, what was the last thing he said, major point in that? Do not move the victim. No matter what, you want to leave them where they are. You don't want to drag them anywhere. You're not trained to do that. You don't have the proper supplies to do so. If they're laid over on their face, on their stomach, and they're unconscious, if they appear to be unconscious, you support their head and roll them back over to their back. But other than that, you don't ever move the victim. Again, there's another thing there. Involved padding. What was that? Does anybody know whenever you checking to see if they're okay? Responsiveness, consciousness. Yes, great. Do you want to do that? Do you want to say it softly though whenever you say it, or just like so loud so everybody can hear it, especially them, because maybe they're kind of dazed and confused. They don't know exactly what's going on, but if you say it loud enough, maybe they'll hear you. And if you see a major injury around the neck or shoulders, upper body, you want to tap on their feet or flick their feet in case of a child, because it'll get their attention. It will prevent more injury. Alright, so again, you want to call 911, a major emphasis. Make sure you call 911. In that case, you saw the person, their hand went down to either the person's chest or off to the side. Some people say you can lay the phone down and put it on speaker and lay it on their chest while you're trying to check their airway, or you can set it down off to the side and try to keep the phone on speaker in order to talk to EMS. But best case scenario, you have someone there that can help, and you give the phone to them, they talk to the emergency responder the whole way through and you can guide them, because you're already in a stressful situation and it doesn't help to have it on the phone to describe everything. You want to check and open the airway. And that involves what 2 steps? Does anyone know? The 2 steps for checking and opening the airway. Kyle's doing that. Tilt the head and lift the chin. That'll try to open up their larynx. And you want to check that for 10 seconds. You don't want to stay there forever and listen, because seconds count, minutes count, and you want to do it quickly. But occasional gasps don't count as breath. So a person like that doesn't count. It has to be a steady breath in and out, or else you need to start responding properly.
There's a speaker over your head. I don't know if you can reach it. That might make it louder.
Oh, it's all right. We're thin.
Okay.
But, all right, so let's go over a few things that we talked about. Burns. What kind of burns are there? What classifications? First, second, and third. What does a third degree burn look like? Bone, tendon, muscle, very, very severe. What about a first? Redness of skin, slight pain, maybe moderate pain. What is the sequence for caring for a choking victim, a conscious choking victim? So we already did, after you've already called 911, asked for consent, after you've done all that, what do you want to go into? Back blows, how many of those? Okay, and how many, like if you're doing abdominal thrusts, how many do you want to do those? 5. Do you want to repeat that, right? You want to keep doing that until EMS arrives or the person will stop choking. In order to open the airway of the victim, whenever you're checking them, what do you want to do? Tilt the head and lift the chin. Alright. Alright guys, so on the back of your papers or on an open sheet of paper, go ahead and you don't have to write the questions, answers will be fine. What does a third degree burn look like? Or what's a classification of a third degree burn? Next question for you all. Should you wrap the sterile gauze tightly or loosely? Next question. When should you stop performing the choking sequence procedures? Final question, where should you tap on the victim when checking on them? 2 locations, we talked about them earlier. One's towards the upper portion of the body and one's towards the lower portion of the body. Okay. And that's all guys.